asked to talk about gastroesophageal reflux disease. This is a condition which 20% of all adult population suffer from. They complain of the symptoms of reflux disease episodically, almost every other month. The symptoms are that of heartburn, chest tightness, feeling of globus, which means feeling of something getting stuck here, and water brush, that is a mouth full of water suddenly, or food coming up after eating food, the food coming up into the mouth. As is evident from the definition, the gastroesophageal reflux disease means gastric means stomach, esophagus means the food gullet, that's a pipe that connects our mouth with the stomach, and reflux means the coming up back of the content of the stomach into the food gullet. That's what causes all the symptoms. Now, gastroesophageal reflux disease has a mechanism, there's a pathophysiology. The pathophysiology is, there are several factors that has been identified. There are more research going on to the more mechanisms that might be underlying. Number one is the food gullet is a muscle pipe which its work is to bring down the food that we eat and chew into the stomach. If there is a problem with the motility of the food gullet, then the food comes up. That also causes reflux disease. That's a contributory factor. On top of that, there's a doorway, there's a valve, a ring of muscle which acts as a doorway between the stomach and the food gullet. Which means if you eat something and the acid content of the stomach is kept in the stomach so that it doesn't come back up the food gullet and cause irritation and cause the symptoms. That's its job. But sometimes it has been seen in people with reflux disease that the resting pressure of the lower esophageal sphincter, as we call it, this doorway, is low. So it remains lax, it remains half open. It's a half open doorway through which all the acid and the pepsin comes into the food gullet. The other factor that contributes is if what we eat, it stays in the stomach for 4 hours and then goes down, it gets digested. In some people, like people who have got diabetes, the motility of the stomach is low, what we call gastroparesis. So there's a movement of the stomach is low, the food remains more than it should be in the stomach, gets fermented, and that also contributes to it coming up through the food gullet. There are several medications to deal with this problem. The categories are, we cut down the acid, so whatever comes out is not acid, so the irritation is not there, the people don't feel the symptoms. And there where the esomeprazole, lansoprazole, pantoprazole comes into action. Prokinetics, which helps the motility of the stomach, also helps. As I said to you already, the stomach food gets properly propelled downwards quicker, so that it doesn't stay in the stomach more than is required. Number 3 is antacids, the liquid suspensions that we use all the time. They are aluminium and magnesium salts. What they do is they neutralize the acid, the same problem, the same mechanism. Or there's a foaming agent which it's developed from a seaweed, and it helps in absorbing all the gas formed from the acid. So these are all the treatments that are available. The complications of reflux disease varies from usual to unusual. The usual ones are like esophagitis, which is inflammation of the lower end of the food gullet causing ulcers, or it can be Barrett's esophagus as found in the Western world. It's not that prevalent in India or the subcontinent, or even adenocarcinoma if it's prolonged Barrett's. Unusual complications are, people can complain of respiratory problems, asthma, or cough, and the mechanism is increased bronchial secretion through the brainstem centers, and the food aspirates, microaspirations, which comes out of the food gullet and goes into the breathing pipe, into the lungs. 30% of asthmatic patients have been found to have gastroesophageal reflux disease, and a trial of these PPIs, proton pump inhibitors, twice a day, high dose, given for even 3 months, from 2 weeks to 3 months, has shown lots of benefits. Um, in conclusion, gastroesophageal reflux disease, there is a lot of investigations that are involved. One is an endoscopy to look for damage. One is a pH monitoring, which is, it's a probe, a catheter. It's very cumbersome for the patient. They don't like it. It's a probe, plastic tube gone through the nose, and it monitors the movement of the food gullet and the acid content of the food gullet throughout a 24 hours period or a 48 hours period. There's a wireless pH monitoring system called the Bravo, which is a capsule that is placed endoscopically into the food gullet and left there for a whole day, and it monitors in a wireless manner all the pH content. The investigations needs to be streamlined more. There are a lot of research going on for the accuracy of the diagnostic diagnostic tools that are available. Trial of PPI twice a day is the most evidence-based investigative tool for gastroesophageal reflux disease so far. Surgical options like fundoplication, it's yet to be confirmed whether they help in the long term or not. There are dietary things that might aggravate. As I said, there are a lot of causes like coffee, tomato sauce, pizzas, and smoking, alcohol. All these things can aggravate increase in the acid in the stomach, and also aggravates or contributes to the reflux disorder.